Hi, my beauties. My name is Dr. Stefani Kappel and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I'm doing a video from Santorini, Greece. We're taking a little holiday, a little break, and just traveling in Europe. And so I wanted to keep the content flowing and keep it going and still stay on time with posting a YouTube video every Sunday for you guys. So pardon me being in this little boutique hotel. I think it's probably midnight here, but it's 2 o'clock in the afternoon LA time. So I'm wide awake and haven't adjusted to the time yet. So I wanted to do this video and I was thinking about a good topic to do. And I know that there's a lot of different topics that I want to discuss that are queued up in the itinerary. But I was thinking about this as I was traveling, and I think that it's time that I do like a video with like maybe my top 3 pieces of advice to give to you guys so that you can avoid bad things happening to you when you have aesthetic procedures done, whether that's injectables or even like a laser or a device, because I've been around a long time. I've been practicing dermatology for, over 15 years, and I've seen a lot of different things, and I don't want to ever say anything negative about some providers who are doing these treatments, but also I want to empower my patients and people who follow me so that bad things don't happen to you guys. So that's the purpose of this video. I can't change what other providers are going to do, but what I can change is hopefully make a positive difference so that you're informed and empowered so that complications won't happen to you or those you love or people who you've talked to and maybe share this information with. And I've been wanting to do this video for quite some time, but usually I'm in my office or I'm in the comfort of my own home and I'm talking about, a new laser or a new device or a new, debunking skin mess or a new trend on TikTok. But I think today, I'm traveling. We're in Europe right now. As a matter of fact, we're in this beautiful boutique hotel in Santorini in Greece. We just came from Mykonos. Tomorrow we're going to Positano, Italy. It's a really fun time, but it's also a time for me to just take a break from work and the daily hustle, and also to reflect and have perspective on not only my career, but the industry that we're in. And I feel that YouTube is a really powerful resource. And again, my content is all non-sponsored, so I don't have a lot of eyes on my content, but for the people who follow me, I want to provide truth and honesty and empowerment. So when you do have cosmetic procedures or when you're trying to decide what treatment's best for you, you can use this information to kind of help guide you to make an informed decision. Okay, so moving forward, the top 3 things that I think are most important to either ask your provider or to think about before getting cosmetic procedures to avoid complications from happening is, number 1, make sure your provider is not watering down their Botox. Now, for those of you who don't know, when Botox comes, now this goes for Botox or any of the neuromodulators, Jeuveau, Xeomin, even Daxxify now, the new longer lasting neuromodulator, Dysport, any of those neurotoxins, they come in a freeze-dried kind of container and you have to reconstitute it. And what does that mean? Reconstituting means you take bacteriostatic water and you basically reconstitute the precipitate. It's a solid precipitate that's around the lining of a glass vial. And you have to inject the suspended in the vial, and you kind of mix it around, and then it's called reconstituting it. And so usually providers, now by the book, usually providers do around, there is a ballpark, but I think a 2.2 cc's for every 100 unit vial of Botox or Xeomin or whatever neuromodulator that the office happens to be using is really important, because that's how concentrated the neuromodulator is. Now, the reason why 2.2 cc's or sometimes 2 cc's, the R&D that these companies put a lot of research and development money into to try to find the perfect concentration where the Botox is going to migrate about 1 centimeter or 1.5 centimeters. It's going to act the quickest and have the longest duration. Now, sometimes when you water it down to get more units out of the bottle, and that's what some offices do, a lot of offices do. I've traveled and taught at many, and I've seen it happen. I mean, it is going on. So I hate to tell you guys that this is happening, but it is. I just saw it last week. I saw it the week before. I've seen it all months. I've seen it for last year. And when I go into these offices and they're saying, I'm getting facial droops, or my patient's Botox isn't lasting as long, and I see how they're reconstituting it, I'm like, guys, you can't do that, because there's two problems with that. Number 1, it's watered down product, so it's not going to last as long. It's not going to last the full 3 months. Now, granted, if you exercise more or you have a higher metabolic rate, you may burn through it faster. So I don't want everybody thinking, who's watching this video, oh, my provider is watering down my Botox because it doesn't last as long. That's not always the case. But if it is lasting a little bit less time than it is when you've had it the same number of units or the same treatment by a different provider, that may be the reason why. And the reason why offices do this is because for a 100-unit vial, they can get a lot more out of it and have a much lower Botox price. This is how you get the $10 a unit. I think in Orange County, there's a Medi-Spa on every corner. There's even like Botox trucks that go around and go to people's offices. And you know that they're doing this because how else would they get, $8 to $10 a unit? There is a phenomenon that happens that if you buy more product, you have a less expensive overhead for the individual vial, but it's never at the amount of, $8 to $10 a unit. I'm one of the, busiest injectors in Orange County, and even I don't get that. And even if I would never change the way that I reconstitute the Botox because it affects the outcomes and it increases the complication risk. So not only does the Botox not last as long and it's not as powerful, but also it can migrate. And this is actually the bigger problem. If your Botox doesn't last, that's a bummer, but you should learn your lesson and go to a different provider. And if that other provider gives you less Botox for the same amount with a better result that lasts longer, then the provider that you came from before was probably watering it down. Again, I'm not saying that all providers water it down, but a lot of them do, especially if they're not dermatologists or MDs or, in our specialty, because we learn this stuff in residency training and fellowship. And if you don't do a dermatology residency or fellowship, you may not be learning this because you're not getting questions on your boards on this. Say you're in plastic surgery, or say you're an OBGYN and you open in a Medi-Spa because you want to get into the aesthetic space because it's a more lucrative career. You're not going to have this background information and you're just going to think, oh, well, I can water down my Botox and get more out of it. And it happens. So the other complication that can happen when the Botox is watered down is it can migrate, and that's the bigger problem. I see this all the time, especially with the crow's feet area. So there's the orbicularis oculi, which is a muscle that goes around the eye, and it's very close to a levator muscle, which basically connects from the angle of the mouth to right next to the eye, right on the cheekbone here. And it's responsible for when it contracts, it's responsible for smiling. So a lot of people who get their crow's feet done, it will, because it's watered down, the neuromodulator migrates outside the orbicularis oculi muscle region and knocks out the levator, and now the person has a facial droop. And also ask, don't be afraid, how do you reconstitute your Botox? Are you doing it 2.2 cc's? Are you doing it 2.5 cc's? Are you doing it 2 cc's? Or are you doing it 10 cc's? Because the people watering it down do like 10 cc's per unit. And the provider will either get shy or embarrassed that you're kind of calling him out, or they'll be defensive and say, no, I get better results with 8 cc's and this is the way I do it, and if you don't like it, you can go somewhere else. And then that will be up to you to do that. But I think that it kind of increases the heightened awareness that, okay, I'm an informed patient, I know what I'm doing, and I'm going to ask you these questions. And if you get uncomfortable, then that's too bad. You don't deserve me as a patient. And that's how I feel. So again, migrating it out and not lasting as long are the two worrisome things that can happen when your Botox is watered down. Now, just because we're talking about Botox, I think it's really important to understand the placement too. I see asymmetric droopy smiles all the time when people try to do the master for TMJ, when people try to do the jawline, when they knock out the DAOs. If you're an injector too and you're watching me, I want to also tell you this one important teaching point, because I see people with drooped smiles all the time. I had a patient just last week. It was 2 weeks before her wedding. I was booked. I have a long wait list. Sometimes people can't get in to see me, and I get it. People go to other providers, and I understand. I would too, and I don't blame you. But just go to a provider who knows what they're doing, because 2 weeks before this patient's wedding, she wanted to get her mentalis, her chin smoothed out, her mentalis muscle Botox, so that it could be nice and smooth. Now, we learn in fellowship that the way that you do Botox in the mentalis is 2-2-1-1, when it's a 2.2 cc concentrated reconstituted Botox solution. And I think what the provider did is she was trying to, the chin was pebbly all throughout this whole area, and instead of targeting it in the most meaningful, safest area, she was kind of he or she was poking it around all over the place, knocked out the DAOs. The DAOs are the depressor anguli oris muscle. We actually do target the DAOs intentionally sometimes when we try to uplift the corners of the mouth when people have kind of like a downturned smile or like a resting B face. And so when you accidentally knock out the DAO, you can have like an asymmetric smile. And so this poor poor girl has her wedding in 2 weeks and literally can't smile, and she looks like she had a stroke, and she's like 28 years old. So I figure I wanted to just throw that out there too, because the placement of the Botox is very important, and you have to know your muscle, your facial anatomy. You have to understand those muscles and the opposing muscles, and you have to know exactly where you're injecting the neuromodulator, and it has to be not watered down so that it stays in the injection site to have maximal effect. Okay, so item number 2, the other thing to look for is to make sure that your provider is not watering down their filler. This is another thing that I've seen more and more happening in practices. Again, when I teach for Allergan and I have to go into practices, I'm appalled at some of the things I see when they take 1 syringe of Voluma and they water it down with saline or bacteriostatic water and to make 3 Volbellas, because the way the fillers are engineered is they have increased viscosity. I'm going to stick with the Allergan profile just so we can be consistent. Voluma is a higher G prime filler. That's the one that usually goes along the cheekbones. It is a thicker filler, meaning it's more viscous. It has a higher G prime. It's more like toothpaste. If you go to Volbella, that's more of a filler that you use for like tear troughs and lips. It is a lower G prime, more watery solution. So it blends into the tissue a little bit better. You wouldn't want to do Voluma under the eyes or in the lips, and you wouldn't want to do Volbella for the cheekbones because it's not going to have a high G prime. So they're engineered based on their consistencies and their molecular cross-linking and their G prime. And the extrusion force for something thicker is, more powerful, especially when you have like a lifting capacity of a filler. But what happens is, and I remember I was at this launch when Allergan launched Volux, and I was on this, we were going to this cadaver lab where we were doing dissections, and it was just an interesting experience for me because we were doing these injections on these cadaver heads, basically people who donated their bodies to science, or these heads, human heads. They're on these tables, and some people were taking selfies with them. Some people were like, injecting them and just being very, I don't know, when you're a physician and you go through medical school, you're very respectful in these situations, and you have a certain way you conduct yourselves in these labs. And half these people, I think I was probably one of only 2 or 3 MDs there. There were 50, Medi-Spa owners. A lot of them were non-physicians, and I don't really know what their backgrounds were, but you could just tell, like, they weren't used to, seeing this situation in these cadaver heads and doing injections on these, people who've dedicated their lives to science, which was upsetting in and of itself. But when I was on this transportation over to the cadaver lab, they were saying, what do you blend your Voluma with? What do you blend it down? What do you water this down with? And I'm like, am I the only one who's not watering down my product? And this is just like the behind the scenes stuff that I just want to tell you guys. And I've been wanting to do a video on this for a long time, but I have just kind of stopped myself. But now that I'm on vacation, I just wanted to just lay it out there because I've been thinking about it. So what happens is when you have a higher G prime product like Voluma and you water it down, you can get like 3 Volbella syringes out of it. And that was the rationale. So when you water it down, you get more product, less overhead, and you can have a lower price point for the product. So people coming in and they're giving 5 syringes of filler, 10 syringes of filler. Again, that's not how I practice either. Filler definitely has its role in aesthetics, but we have lasers, we have tightening devices, we have neuromodulators, we have skincare, we have surgical procedures, non-surgical procedures that kind of go with filler, but filler is just not the end-all be-all answer to lifting up the nasolabial folds or lifting up the jowls, or of course for lip augmentation and tear troughs it really is helpful, but just going overboard and doing too much too fast is also another problem that you want to avoid. So some of these providers are giving, I remember them showing off saying, I give no less than 5 syringes for every new patient. And they're like, their goal is to give every new patient like 8 to 10 syringes. And I'm just like, whoa, okay. As somebody who, is a professor of cosmetic dermatology, like, this is not how we teach. This is not how we were taught. And this is not what you want propagated out there in aesthetics, because not only are people going to look weird, you see it with celebrities all the time. And they have a very odd, weird, unnatural looking face, and it just happens when not only there's too much filler given at one time, but also this watered down filler when it's blended, or they call it blended filler. I feel that when you mix it, and I've actually talked to some people who are specialists in pharmacokinetics who actually are on the other side of engineering these products, when you water the product down, it changes the molecular configuration and it changes the way the hyaluronic acid binds water. So it gives this weird fluctuant blue, tindally effect, weird facies, and that's part of the problem too. So it's not only doing too much filler, relying too heavily on filler to lift and tighten and pull, but doing way too much, way too fast, and then watering it down and blending it down to get it to a lower price point, which changes the molecular configuration. It changes the binding capacity of the hyaluronic acid filler to water. And that's why, especially like in this area, you get those women who get like those really small, like weird cat eyes, or you see, I hate to talk about celebrities, but you see Madonna, you saw some of these other celebrities that we post that just look very odd. And I think that that has to do with not only doing too much filler, not injecting it in the right facial plane, and watering it down to get more out of a syringe of a higher G prime filler. And it gives you a lower price point as a patient, but is it really worth it when you have those outcomes? And again, I'm not saying that all filler, when people look overfilled and have that weird look, I'm not saying that it has to do with blending your filler and watering it down. I just think it has to do with doing too much filler. You do things like tightening devices, you do L-Liquor, you do lasers, you do things that are going to induce your skin cells and your fibroblasts to make more collagen, more elastin. And not only do those results look more natural, but they have longevity and they last a longer period of time and they look more natural. Then after that, if you want to add a little bit of filler in the jawline or in the chin or a little bit of Voluma up here to kind of lift, tighten, and pull, then you mix that in with other treatments. But you don't say, okay, here's your filler, let's lift it up. And then a year goes by and you're like, oh, I've fallen again. Let's do a little bit more filler and lift it up, and then more, because then you start just distorting the face and looking weird. I always say filler is like one set of equipment at the gym. You could do your cardio, you could do your resistance bands, you could do your machines, you could do your free weights, you could do your trainer. Doing a little bit of everything will globally give you the best physique and the best outcomes, not just doing the treadmill all day or just doing one set of weights and working out one muscle group all day every day for like a year. You have to use these things in conjunction, and you have to evaluate the facial aesthetics as a global presentation and just see what's off and what could be used to kind of tweak this and that over the years, and do procedures that are going to keep you looking like the best version of yourself and natural over time, but is not going to change your face. Okay, so the last and third final thing that I want you guys to take into consideration when having a cosmetic procedure done. Now, we've talked about neuromodulators, we've talked about fillers. Now I want to talk about devices, and this goes for any device, whether it's an energy-based device like a Thermage or a Softwave or an Ultherapy, or if it's microneedling, or if it's microcoring like L-Liquor, or if it's a laser, especially lasers, because you should see some of the complications that I see. Because although I'm a huge proponent of lasers in the wrong hands and with the wrong patient selection in the wrong settings, can be catastrophic when it comes to scarring and complications. So especially if you're a darker skin tone. So if you are a darker skin type, lasers, you are a candidate for lasers, but you have to have a laser provider who knows what he or she is doing, especially with laser hair removal. There's different lasers for hair removal, and you have to take into consideration the melanin in the skin to make sure that you don't burn, hyperpigment, or depigment the skin. And I see this all the time, and sometimes, complications can be reversed and sometimes they can't. So it's a really sad situation when it's a complication that is going to be lifelong and is irreversible. Also with microneedling, I'm not a big microneedling fan because I feel that the results are often underwhelming, and it can be expensive, and it usually requires multiple treatments, and also it can hyperpigment darker skin tones. And so when you're going to especially a med spa, especially if there's extenders, there's not like a fellowship trained laser surgeon there, or even an MD overseeing the entire med spa, don't be fooled by thinking, okay, well, this is a plastic surgeon's or this is an MD's med spa. That MD may or may not even be there, and that MD may be a cardiothoracic surgeon or a plastic surgeon. Those guys are great at surgery, but let's be honest, when it comes to skin, they don't get the intense training in lasers and injectables and cosmetic and aesthetic procedures in dermatology that we do, which is fine, but you just want to make sure that you're going to somebody who has expertise and knowledge and is not going to mess up the settings, is not going to cause a complication, is not going to hyperpigment you, because laser complications are, again, catastrophic, and I see it a lot in my office. And so, just make sure that you ask your provider about his or her level of training. How long have you been doing this? Why do you have, a clear and brilliant instead of a Fraxel? Or why don't you have a Pico laser? Some of these lasers are take a higher level of care to understand how to use the settings. But for someone who understands lasers and can patient select and choose the right appropriate wavelength and setting for your skin tone and what we're trying to correct, there's nothing like those laser results. It's just harder to find, you know, a laser provider who is highly trained and hopefully fellowship trained in laser medicine. So we're fewer and farther between. And so, you know, I love it when you guys ask me, hey, how do we find an ACGME fellowship trained laser specialist? And I live in this area, and who can I find near me? Those are really important questions to ask. Now, that's why in med spas you'll see more IPL or BBL, which is broadband light, which is not really a laser. It's just a light device that you put a filter on that kind of makes it act like a laser, but you can't push those devices to get the outcomes that you can when you have like a pristine laser. But it's harder. It's kind of like having a Lambo and a race car driver, or you have, you know, an everyday car with a person, you know, an Uber driver who can basically drive any car. You're going to find more of those cars, more abundantly that you're going to find, you know, the Lambo with a race car driver, but definitely just going to get you to point A to point B faster. They're just harder to find, but when you can find it, and if, you know, you have a delicate, you know, skin tone and you want to avoid complications, that's the route you want to go for. So just be careful when you're going into a med spa, especially with microneedling and some of these lower tier treatments, BBL, IPL. Make sure that your provider knows what he or she is doing. Ask them how long they've been doing this, and ask them where they got their training. I was at this training the other day, just a couple weeks ago, and I wanted to do this video right after the training because it was fresh in my mind. And this woman had, I mean, she was a neonatal intensivist. She was a NICU nurse, and that's a very impressive, I mean, career path. But that doesn't mean that just because you can put an IV in a 2-pound baby that you're going to be able to be performing lasers and Botox and fillers. So, you know, I saw the other day too on Instagram, this woman's like, I'm a CCU nurse and I opened this med spa, and, you know, we're doing Botox. It's, you know, we do this, we perform all these services. But just because you're a CCU nurse, that's amazing. That's an amazing career path. It takes a long time to get to, but that doesn't mean that that person's going to be an expert injector. Just like a cardiothoracic surgeon, that person can do open heart surgery, but do you want them doing your filler or choosing your laser settings to treat melasma in a type 3 skin? It's just, they don't really cross over very well. So just keep that in mind. So there was an office that I went to just a couple weeks ago, and I wanted a little bit of time to lapse before posting this video because I didn't want that person to identify me talking about that office if he or she happens to watch this. But it was a practice that had been open for about 3 years and was having a lot of complications, and they wanted me to go in there and help this injector. And I asked, when I saw the technique that she was using, I asked her, I'm like, where did you learn this technique? Because nobody who's gone through a proper training course, I'm not saying you have to do 3 years of derm residency and 2 years of fellowship, but just at least maybe a 6-month course or a very intense course, wherever that is, to give a provider the skills so that they can have responsibility and accountability for treating cash paying patients. And she's like, oh, I learned it on YouTube during COVID. And I was just like, I was so appalled. And she was an ICU nurse, which granted, that's a very coveted position. That's a, you know, very respected position to be an ICU nurse. I'm sure she could save lives in the ICU, pick out ventilator settings, do, you know, an ABG. I'm sure she was amazing, but that doesn't mean that you know how to operate lasers and how to inject Botox properly. In fact, she's having a lot of complications. And I just, you know, that comes up a lot. I think I had a patient the other day who also had a complication. She's like, I just went to this med spa, and the owner of the med spa was a CCU nurse. But a CCU nurse, you know, that doesn't mean, you know, they're a doctor of nursing. So she introduced herself as a doctor, which I also think is very misleading. This stuff is going on. And just because you can work in a CCU unit and save lives in a cardiac intense unit, that doesn't mean that you have any business practicing in a medical space in aesthetics. So just remember that this stuff goes on. And she also took a product that we used on a patient, and because there was a little bit left over, she wanted to save it for the next patient. And so I just, having these kinds of things happen, I'm just like, I need to tell you guys what's going on out there. Again, I'm not saying all practices have this, but there's a lot of them. Enough for me to prompt me to do this video to empower you guys. So going back to lasers and energy-based devices, just make sure that you're going to someone who's maybe taken a training course. You know, people don't want to spend the time and money of going through a training course. They want to open up a med spa. They want to start making money quick and fast. They don't disclose to their patients that they haven't been doing this. You may be the first or second patients they've ever treated. So just knowing to ask these questions, I think, is really, really important, especially you know, when it's your first time, and maybe for your first time, you should get your feet wet or have your first experience with somebody who has a higher level of training. And then it's safer to go to maybe, you know, a lower tiered office where you can say, hey, this is how many units I had, or this is the laser I had, if these were my settings. What do you think about this? So, and you know, empowering and education is everything, and hopefully this will make sense to you guys, and hopefully yield a lot more positive experiences and less complications. And again, when I'm on vacation and I just have a better perspective, these are the things that I was thinking about, and I wanted to do this for you guys. So drop a comment in the comment section. Let me know what you think of this video, and share any of experiences if you guys have had any, and let me know what you guys want me to talk about next. I'll be in Italy next week, and I'll do a video live from there, and we'll do a video on anything you guys want to hear about. So drop a comment, let me know. Okay guys, I wanted to show you a little BTS. I never do this in my videos, but it's so beautiful. Here in Santorini in Greece, I wanted to share with you guys because I feel like you guys are always here with me. It's like 1 in the morning here, but it's so beautiful. Yamas.